I have to admit, this was one of the first videos that I was researching that I actually started to get really angry at what is going on with the American health insurance system. And so I wanted to share with you today, because this has come up recently for me personally with my family and experiencing really high medical bills, and we have health insurance. And I wanted to share exactly what this is looking like for us and our families, how much this is costing me personally, with a couple of stories to share, and then some alternatives and what you can do about it to make sure that you are aware of your health insurance plan and how to keep that cost low. Okay, so the first thing that I want to talk about is just how the American health insurance system is set up, because it is so different across different plans and health insurance companies, and also there are other government insurance plans that you should be aware of. So let's hop over. I'm going to hop over to the National Library of Medicine because I saw a really good definition that I wanted to share. Okay, so in this paper that I found online, it says the United States primarily relies on employers to voluntarily provide health insurance coverage to their employees and dependents. I'm sure most of you are on some type of employer health insurance plan. Government programs are confined to the elderly, the disabled, and some of the poor. These private and public health insurance programs all differ with respect to benefits covered, sources of financing, and payments to medical care providers. There's little coordination between private and public programs. Some people have both public and private insurance, while others have neither. Nevertheless, persons without health insurance are not entirely without health care, although they receive fewer and less coordinated services than those with insurance. Many of these uninsured individuals receive healthcare services through public clinics and hospitals, state and local health programs, and so on. And so this is where it's kind of like there's so many options. There's a lot of different things that you can choose from, but primarily you are going to see a lot of employers providing health insurance programs, and that's typically what the government relies on in order for the bulk of us to be insured. Okay, so we talked about private health insurance that is mainly available to us through your employer. We also have the Affordable Care Act, also known as Obamacare, that was enacted in March of 2010. So it's been 13 years since that program was released. And really it's got 3 goals that I found on healthcare.gov. And that is to make affordable health insurance available to more people, expand the Medicaid program to cover more adults, and also support innovative medical care delivery methods designed to lower the cost of healthcare in general. And so you're going to see that also in effect. In addition to that, there is Medicare and Medicaid, as they've mentioned in Affordable Care Act. So Medicare is health insurance for people who are 65 and older, and Medicaid is designed for low-income individuals. When you're thinking about getting health insurance, especially if you're onboarding with a new employer, you want to think about a couple of questions to ask yourself before you jump into a plan. I liked what this document and what this page said on Stanford, which said key question number 1, where can I receive care? Number 2, what does the plan cover? And 3, how much will it cost? Very simple questions, but I think it's a good idea to kind of think about those things, especially as you're trying to enroll in new health insurance plans. Once you get inside those health insurance plan options, you're going to see a lot of different abbreviations such as PPO and HMO and HDHP. I won't get into those in this video, but I will share with you exactly what Kyle and I have been using for our health insurance, and that is a high deductible health plan and HDHP. High deductible health plans typically means that you're going to be paying a higher deductible, and you typically have lower premiums as a result. Also, high deductible health plans come with a health savings account, which is a built-in savings account which you can contribute pre-tax dollars into a savings account. Sometimes your employer will also kick in a couple $100 into that same account, and you can use that money to pay for qualified medical expenses. is. You can also opt to invest that money into various investments in which those contributions grow tax-free, and so you can also use it tax-free to pay for those medical expenses. It's a fantastic thing. I love a health savings account. I've actually done a whole video on health savings account I will link to up here in the cards if you want to learn more about that component. Even though you have that component, it is $7,750 per year in which you can contribute into that account. And then that amount of $7,700 can be divvied up in between your employer contributions and your contributions. So you can't do $7,700 and then your employer adds an additional $2,000 on top of that. It has to equal max that amount, or $645 per month. So one of the examples that I like to give is the cost of giving birth in the US because it's just ridiculous to give birth in hospitals these days. And so I wanted to share those costs with you as I was being billed for these amounts and these bills on a high deductible health plan with a health savings account. So I actually received 2 bills, one for myself and one for my daughter. My bill in total was $20,679. Now, what was included in that was vaginal delivery, some lab and pharmacy stuff, and room and board. By and large, room and board was the most expensive line item on my bill at $13,500. Now, the plan paid $17,694, and I owed $2,984 just for me. In addition to that, I received a second bill for $22,611. And what was included on that bill was lab and pharmacy work for my daughter, occupational therapy, lactation consulting, and room and board. This was the most expensive line item at $18,600. Now, I will say that our hospital stay was longer than a typical birth, if you will. Usually you'll have maybe 1 or 2 nights at the hospital after you give birth, but because Quinn was low birth weight, we actually were in the hospital for like 5 days total, and so that's what's contributing to such a high amount. So the plan paid $19,566 and I owed $3,045.15. So the total to have a baby was $6,029.70, which I had to pay out of pocket. Luckily, I found out a way to negotiate my medical bills, and I received a 30% discount by paying that medical bill in full. Luckily, I also had a health savings account. I still think this is a ridiculous amount of money to pay to do something that I can naturally do on my own. And yes, it was great to have my midwife there and nurses there to kind of help and support in things that happen after birth, such as more bleeding that I needed medication for, and yet it still cost me $6,000. Another thing that really ticks me off, and I'm totally gonna get on a soapbox here, but we recently went to the pediatrician because Quinn had developed a skin infection. The visit was super easy, probably 10-15 minutes max. I really loved the pediatrician who came and saw us. He knew instantly what the infection was, and he knew exactly what medication to prescribe. Great, love it, fantastic, we're on our way. The visit was $500. The doctor had billed my health insurance company $500, in which the health insurance company paid little less than half. And so now I'm on the hook to pay $269 out of pocket for that visit on top of the $16 we paid in pharmacy and prescription medication. I am just so baffled by this. I have no idea why it cost me $500, why health insurance and I have to 50-50 this bill. It just makes absolute zero sense. While I had the health savings account to help pay for this, I still think this is absolutely absurd, and that it shouldn't cost $500 to go see a doctor for a very simple yes, no, here's your prescription medication. I could have easily gone to maybe be in urgent care and paid $60 out of pocket and probably would have gotten the exact same answer with a similar prescription. And on top of that, not only my own experiences with high medical bills, recently the COVID vaccines are expected to increase in cost. As the federal government is pulling out their funding and dwindling that down, companies like Pfizer and Moderna are ready to charge people up to $130 per vaccine. I think this is absolutely insane given, and I know probably most of us got our vaccines for free. I know I did, but knowing like babies that are just coming of age to get these boosters, and now parents are asked to fork out $130 per dose, and keep in mind some of those dosages are in rounds of 3 instead of 2. So Quinn actually got 3 rounds of the COVID vaccine. I just think this is absolutely insane. I have no idea why Pfizer and Moderna want to increase their costs like this when their profits are already inflated and they've made billions of dollars on their medications. It's just ridiculous. Now, what's a better solution, Justine? Because you're really complaining a lot, and as much as you probably like to watch me and listen to me complain, there's got to be a better solution. Now, I've definitely taken a look at universal healthcare solutions, such as our friends have experienced over in Europe. And so a lot of these countries, actually, their governments provide universal healthcare coverage regardless of an individual's income, meaning everybody has basic access to different healthcare options and standard procedures that everybody needs access to. So I found some really good information online about healthcare systems in Europe by country. So then you can see the type of healthcare system that they implement, whether or not it's mandatory and whether or not it's truly free, and if you're an expat, if you're also included. And I loved seeing this list of how many expats, like how many countries included expats, which was amazing. So a ton of these countries actually offer free health insurance, except for maybe small service fees, or 70% of your medical payments are reimbursed by health insurance, which I really loved. France is set up that way, or 100% reimbursed for long-term patients. And then also a lot of these have a mix of either public health insurance or a mix of public and private. So actually I found this other article here that says private health insurance can also be purchased as a supplement to the national healthcare system. So let's say that you have a basic universal healthcare system, but then if you want more on top of that and more options available to you, you can purchase private health insurance for a small fee. Universal healthcare coverage has been a big political debate in this country, and a lot of people are going to say that this is really going to affect your taxes. And I say, if this affects my taxes, but it also directly impacts me, why wouldn't I want to see my tax dollars work for something that I directly benefit from? So that's how I've been really looking at universal healthcare. And also, in addition to that, or aside from that, I truly believe that healthcare institutions should be mandated to provide a menu of standard procedures and services with fees attached to them. So many times we go into our hospital visits, or for me, giving birth in a hospital, and not knowing exactly what that cost is going to look like. Had I known going to my pediatrician's appointment for Quinn's skin infection was going to cost me $270, I would have looked elsewhere for a cheaper alternative. If I knew I could get that same amount of care with maybe a walk-in clinic that was only going to cost me maybe a third of the price or a fourth of the price, hands down, I would have gone with that. And so it gets me thinking, and for you maybe, how often have you thought about, you had some sickness or an ailment and you thought about going to the ER, but you hesitated and said, actually, I'm going to hold off for a couple of days and see what this thing does, because you knew that a visit to the ER could potentially cost you hundreds, if not thousands. So then I got to thinking, okay, well, what if you want to retire before the age of 65, and how does that impact your health insurance needs? Because we know as you get get older, you may need more access to health insurance and healthcare in general. So I talked to a family member of mine who retired before the age of 65, and I was curious what they did for their health insurance. And they said that they were on COBRA for 18 months, meaning they retired from their employer and then they stayed on their employer's health insurance plan by paying a little bit extra in those premiums. So they still got full coverage, but they paid $1,200 per month for 2 people. After those 18 months were over, they switched over to the open market. So the government's open market health insurance plans where you kind of pick and choose, and it's a little bit of the wild, wild west. So they opted into a plan that was $700 per month with, get this, I'm not joking about this, a $15,000 deductible with very minimal coverage. In fact, my family member told me that this didn't even cover a basic flu shot. $15,000 deductible. Why is this plan even available on the open market? It's just ridiculous. Now, once this person turned the age of 65, they were able to enroll in Medicare, and they just had glowing reviews of Medicare. They said it was wonderful. They signed up for the United Healthcare Advantage plan, in which there's actually plans A, B, and C that you can pick on Medicare, and some of them just gives you access to more options, and so that was an additional $19 per month. And then the plans that they picked was about $169 per month. So all in, less than $200 per month that they are paying for as a part of this Medicare program. And the plan that they're on actually gives you the ability to see any doctor at any time without needing a referral, so they can go directly to a specialist. In fact, my family member told me the Medicare plan was so awesome that they were able to book appointments and got things checked out and looked at and standard procedures done that they had been putting off for a very long time, which really to me drove home the point that people will put off wellness because of cost. And really, if you think about that on your current health insurance plan, maybe there are some things that maybe I should get, that cyst taken a look at, or maybe, I have this pain in my neck, or maybe I think I have ADHD and I need to go see a doctor about that. Think about all those things where you're like, it's not a true emergency. I really want to get it done, but I'm putting it off because I don't want to pay for it. That's why I think something like universal health care could actually really be of benefit to us. But aside from that, what are some things that you can do right now when it comes to your health insurance and your health care? The first thing is to review your benefits thoroughly. I feel like a lot of people just don't even look at it. They just look at their take-home pay and call it a day. Really review those benefits thoroughly, and then look up how much you are paying for in health insurance. What is your share of the bill, and then what is your employer putting in? Now for Kyle, he pays $400 per month out of his paycheck to cover health insurance for himself, me, and Quinn. His employer also kicks in over $900, so we're looking at over $1,300 per month in health insurance for a family of 3. See what this actually costs for you. Then review your out-of-pocket medical care costs from last year. This is a really good idea to look through, especially if you've been with your employer for more than a year. You can take a look at the different claims that are on your health insurance portal online, and you can see how much that costs added up. See how much you actually paid. Then you can determine which health insurance plan works best for you. Those with chronic illness who have to see the doctor often may not like a high deductible health plan because those bills are typically going to cost you more, as you saw from the stories and examples that I gave. Maybe you're better off with doing an HMO where you have a copay of like $30, but your premiums are typically going to be a lot higher. The next thing you can do is compare those healthcare plans. Maybe you compare the HMO plan with a high deductible health plan versus a preferred provider organization plan. So take a look across the board and see what works best for you, and then also vote for officials that really put healthcare and health insurance needs in mind, that they are not putting profits over people, and that they are looking for reform to make this more accessible for everybody. My hope is that we live in a country that really values people and making sure that basic needs like their health and their well-being are actually being addressed, and nobody is feeling like they can't get access to that because of the cost. Okay, that's my soapbox on this. Let me know, what are your opinions of the American health insurance system? Maybe you don't live in the US. Tell me what it's like in Canada, in Europe, in Australia. How much are you paying for health insurance, and how much are you paying for standard things like visiting the doctor, or maybe you've had a baby? How much did it cost for you to give birth? And I know that also varies inside of America, because I did talk to a friend of mine who only paid like $500 out of pocket for her birth, and I'm like, this is insane. Again, with the menu of options of health insurance plans in the US, is just, you either pay very little or you pay a lot. Let me know if you like this video, give it a big thumbs up, and don't forget to subscribe. The community of debt-free millennials here is committed to crushing debt and living payment-free, and also just learning how to better take care of our expenses as they pertain to things like healthcare. So I'll catch you in the next video. Bye.